our very important guests here this morning, namely our Honourable Minister, Blade Nzimande, Minister of Higher Education, Science and Innovation. Then we also have in our midst the CEO of Higher Health, Professor Ramnik Aluwali, and then online you will meet Professor Sibusiso Sifunda, who is the Chief Researcher from the Human Science Research Council, and he will also be responsible for sharing with us the results of the impact study. We hope you will find this day informative and of great value. Today is the coming together of plans and reactions to the pandemic. CPUT, I believe, has a significant role in the Western Province and have played this role in the province effectively. We are proud to be selected to host this event today, not only because we have done extremely well in combating the virus, but also that this campus has been chosen to release the results. The fact that we have an accredited vaccination center will make it possible for us to contribute significantly to not only our staff and students, but also to our surrounding communities. During the course of the proceedings, we would like and encourage those who have joined us also online with the Zoom to raise questions they would like to ask in the chat function of Zoom. I would also like to reinstate the importance of adhering to all the COVID regulations. Please keep your distance, please sanitize. We will really appreciate that. And in terms of our speakers, you are welcome to take off your mask and after to put it back again. So with those introductory words, I now call upon our Vice-Chancellor, Professor Chris Mshlapo, to do the official welcoming. Over to you, Vice-Chancellor.
Thank you very much, Professor Heiswemer, for the very kind introduction. Good morning, ladies and gentlemen. Goeiemôre, dames en heren. Molweni mawethu. Molweni. Minister of Higher Education, Science and Innovation, Dr. Blade Nzimande, CEO of Higher Health, Professor Aluwalia, Professor Sibusiso Sifunda from HSRC, along with members of the media, CPUT staff, council members, and our peers in the higher education sector, especially Czech universities, the 4 universities, as we normally say, 4 universities, unlimited possibilities. I also welcome our sister institution in the region here. We welcome you to the Cape Peninsula University of Technology, Belleville campus. It was exactly 1 week ago that this campus was the host to yet another important event, the opening of the first COVID-19 vaccination center. It was a proud moment because it solidified our status as being a low-risk institution in terms of the transmission of COVID-19 virus. Our success in the interim can be directly attributed to the very essence of who we are as an institution. For a number of years now, we have had a guiding principle of one smart CPUT. This one smart CPUT is taking technology into account in one dimension and the oneness in another dimension. And this empowering mantra has never been more evident than in the past year as we navigated the unexplored territory of the pandemic. We have been one smart CPUT from the very beginning, when we realized the gravity of the pandemic unfolding and quickly set up a COVID-19 response unit that infiltrated every unit every department and every faculty at this institution. From the Vice Chancellor's office to the security, we have been meeting every second day to strategize and with agility react to the challenges presented. And thus far, the results speak for themselves. All the while, we have also never lost sight of another element which makes us unique, which is our heart. While needing to make tough decisions about the academic project and other institutional processes, we have been careful never to lose sight of the 40,000 individuals who make up the community of CPUT. 40,000 who were also scared, confused, disoriented, and not knowing exactly what is going to happen the next day. This caring attitude is also evident in the aforementioned vaccination center, which will not be vaccinating only our staff and students, but the broader community as well. Staff by our own and the capacity to vaccinate in the region of 500 individuals per day, and we hope to help as many people as possible. Universities are often warned about becoming ivory towers of esoteric knowledge, far removed from the realities of societies. But we know today that good science can no longer be for bright people only, but is a public good. Good science must address existential crisis. Good science must address the demise of our planet. Like this vaccination center, CPUT has always been embedded in the communities it serves and will continue to do so. Honorable Minister, later you'll hear from my colleagues in the institutional COVID-19 response team on exactly how Cape Peninsula University of Technology has fought the virus from the front lines. As I wrap up, I would like to take this opportunity to say a very heartfelt thanks to them for availing themselves so willingly to keep CPUT safe. Their efforts are truly appreciated. Thank you to the Department of Higher Education and Training and Higher Health for constant guidance and assistance offered. Your support has helped us to achieve some of the gains we celebrate today. The Honorable Minister, we are looking forward to the results of the comprehensive study of the impact of COVID-19 on the youth and students, especially during this youth month. This is critical as we know from statistics that as a country, we're a youthful nation. Happy Youthful Month, and thank you, Baya Danki, and Thank you very much.
Thank you, Vice Chancellor, for one smart and very warm-hearted message of welcoming. We have now the honor to invite Professor Ramnik Alawali, CEO of Higher Health, to set the scene for today's deliberations. Over to you.
Let me start by acknowledging the Honorable Minister and his presence. Minister, such an honor to have you. Vice Chancellor and your management, thank you very much for hosting us. Prof. Chris, you have been a huge inspiration. Thank you very much. To everyone present, students, youth, management, as well as media houses, a huge warm good morning from my side. It's a momentous day for us today. The Minister has always guided us by continuously informing us that we have to work with science. And I think if you look at all the protocols, all the work of Higher Health has been led by science and its epidemiological understanding and the virus understanding. 1 year down the line, we know a lot more than we knew last year at the same time when we were predominantly in the March, April month when the virus hit us. It's momentous because we haven't much spoken about the COVID impact on the youth. In fact, if you look at most of the studies, it's predominantly about the impact of COVID on the elderly, the comorbid conditions, the middle age. But the impact that COVID has on the young people is also critically important for us to understand. In fact, if you look at the virus, as much as it's now a pandemic and a global epidemic, it's actually now become endemic, which means it's coexisting with humans. When the virus becomes human to human, it starts moving from one body to the other and enjoys moving from one body to the other. What the study and the science has shown us, that whether you are young or you're old, you're equally vulnerable to the virus. And the virus doesn't spare whether you are a young person or an old person. It moves nicely as long as you are a human body. Now, keeping that in mind, with the new mutants and the variants, looking at the latest COVID outbreak in India as well as in Turkey, it's predominantly clear that the variants are showing high affinity to young people. Last month, we lost a student in TUT, a brutal reminder that COVID and complications do happen on young people. And there are fatalities among young people too. We are a vulnerable society as higher education at times. We are a congregate setting. We have young people together in classrooms. We have young people in residences, residing and staying together, which means that the virus finds exactly what it is to move from one human to the other. The only way we can break the chain of the virus is, as we all know, mask or social distancing. And predominantly why? Because that's where you break the chain of the virus, because you're not allowing the virus, what the virus wants, to move freely from one human to the other. And it keeps moving from one body to the other till it finds the body, it resides nicely inside, starts mutating, and all it's doing is trying to defeat our immunity. And all the virus will keep on doing is to keep surviving by defeating our immunity. And this study of ours today is very, very critical on the young people. It is looking at the demographic characteristics of the young people and the impact of COVID-19 on it. It looks at the socioeconomic conditions during lockdown, knowledge of COVID-19 and sources of information on COVID-19, the risks perceptions from young people on COVID-19, impact of COVID-19 on learning and institutional support during lockdown, well-being, mental health, and social support, drills down as deep as data, electricity, food, and areas which Professor Sibusiso will predominantly declare us much in detail. It talks about substance abuse, gender-based violence, and many other impact. The loss of parents and grandparents, which Minister keeps reminding me every time that it is hugely impactful on our young lives and our young people. We are commemorating, we are in the youth month. We have a 16th of June in 1976 when our youth showed us a way. And I must proudly say in 2021 that for 1 year, 14,000 frontline soldiers, which are our youth, student volunteers, supported Higher Health and all our institutions against this fight of COVID-19. Myth busting, contact tracing. When people were scared to enter our campuses, they were front standing and informing people that we can coexist with this virus. And now they're playing a huge role with our vaccination education at this moment. So today is a day where we will hear the COVID impact study from our research team, led by Professor Reddy and Professor Sibusiso, and we will see the details of our research. But equally, we are going to, by the minister, we're going to lead to what the minister has asked us to develop is a PSET vaccination strategy. And when we talk about PSET vaccination strategy, we talk about how do our universities, how our post-school education system play an integral role with our national vaccination program. So not only just from the education and myth-busting perspective, but can our institutions also become vaccination points for our communities? It's easy access to the community. We are in Belleville. There are people in Belleville around us, and they can easily come into our institution and get vaccinated rather than overcrowding our Department of Health facilities. And I'm very proud to announce that the minister will actually have a chance to look at our first of our kind vaccination sites. We have Nelson Mandela University. We also have University of Western Cape and many other universities that are now getting registered, but led by CPUT. And we will have a huge honor to see how the scale up of the vaccination program is happening from our institutions. We are prepared, Minister, that when the time for our staff and students will come as the phases of vaccination move, we will be prepared to be able to have our staff and students vaccinated on our campuses. And that's the vision that we are moving with. And but the most important part is vaccine education. We will not win if we do not fight the stigma against vaccine, if we do not make people understand why vaccine is important. The results so far from the Western world, which has vaccinated a huge population, has clearly shown vaccinations are highly effective. Vaccinations are equally effective as we talk about social distancing or mask wearing. Because what vaccines will do is it will decrease your viral load very quickly. It will produce the immunity to such a level that when the virus comes inside the body, it will not allow you to go into hospitalization or critical health problems that the COVID eventually leads us into. And I think that's what we need to learn about. So I think with that note, it's a huge honor that I leave it back to the researchers to take us through the findings of the research. Thank you.
Thank you so much, Professor. It's always great to see people's passion when they do things. And I think since we've started to engage with you, that came through. And if one is passionate about what you do and you believe in it, then it will be a success. Now it's the moment to move to our scientists and our researchers. And I'm going to ask Professor Sibusiso Sifunda and his team to share with us the findings of the impact study. And this will be done online.
Hello, good morning. Hello, good morning.
Those usual online gremlins that keep coming in, but this presentation, we're expecting the Minister Nzimande to release results of the study on the impact of COVID-19 on students in this post-school education and training sector as part of commemorations of Youth Month. This briefing, the Minister of Higher Education, Science and Innovation, Dr. Blade Nzimande, releasing those results of a comprehensive study on the impact on COVID-19 on this sector. The Human Sciences Research Council and the Higher Health conducted the study, which covered all universities and technical institutions. Let's take a break. You're watching The Agenda. We'll be back in a moment.
From grade 1 up until grade 4, I was bullied about my dark skin complexion. That made me to hate myself. I have learned a lot from SABC. I have learned to respect yourself and respect other people and love yourself. One of the shows that have inspired me is Skim Sam. It shows that no matter challenge that you're going through in life, you can make it. My name is Njabula Zulu and I'm 13 years old. I am a motivational speaker, a violin player, and anti-bullying activist.
Start your day with Morning Live every weekday between 6 and 9 for updates on everything you need to know before you go.
Catch up on stories making the news, your latest sports updates, weather and regular traffic reports.
Morning, Robbie.
Good morning and welcome back to Morning Live.
Make sure to kickstart your day with Morning Live every weekday between 6 and 9 on SABC2 and SABC News Channel.
You will never have a difficulty on application. One left of a principle that you will...
Morning Live, everything you need to know before you go. Give us an update as to what's happening at the moment.
7 people have been arrested. We saw the community of Mushawana village blockade this road. We're not going to vote.
Each and every consumption to our school, are going to expose it.
Protesters are complaining. Beneficiaries are saying they haven't seen any dividends.
This is Richard Kimber for SABC News in Hong Kong. It's one of the world's most densely populated cities, and as a result, everybody here has been covering up and wearing face masks for the past 18 months whenever out in public spaces to try to reduce the risk of community transmission. Also, as a journalist, I always carry with me a small tube of hand sanitizer to disinfect my hands after going into public spaces or filming in busy office environments, and also a small pack of disinfectant wipes to clean down any pieces of equipment, such as my microphone, that may come into contact with multiple people during the course of the day. Just a couple of tips to help protect yourselves and others and allow you to continue doing your job as best as possible amid the challenges of the COVID-19 pandemic.
My name is Lesharanala Mafela. I'm from a small village in the outskirts of Mafikeng called Batsepa village. I was born without arms. In 2019, I graduated from the Northwest University with a Bachelor of Commerce in Economics. I'm a musician, I'm a DJ, music producer, a songwriter, I'm a father too. I'm disappointed on the day itself, the 16th of June, because of the people that are actually appointed in Parliament, Noyana, are the same people that were in the street throwing stones. Let's get free education and quality education. Those are the same people that should actually be pushing such agendas, such matters in Parliament, because they are our current leaders. But they're not doing that. I would suggest the government should probably either reduce taxes on disabled employees or actually cut the taxes off completely on disabled employees. The same way they were able to provide the disabled person from a young age with disability grant, they should also be able to do that on taxes.
Welcome back. Let's take you back to that question we're asking you for the day. The UK Prime Minister Boris Johnson says vaccinating the world by the end of next year would be the single greatest feat in medical history. Do you think South Africa can meet this target? Let's take a look at some of your thoughts. Thabo Mzamani says, yes, I believe South Africa has the potential to vaccinate all its population by 2022, as long as corrupt elements are kept at bay. Nazim Grootboom, no, South Africa won't meet the target at the chameleon pace they are going. Even we can extend it to 2025. Have some hope, Nazim. Thabo Quincy Peter saying, if there were no thieves in South Africa, I would say yes, but since we're surrounded by the thieves, my answer is no. Mosimane Khape Thapi says half of the population would have died in our country by then. The pace of the vaccination in the country is very poor. Ramoro says never ever South Africa can't meet the target, even if it is to be extended to 2025, unless the government allow private organizations, schools, churches, etc., to vaccinate their own people, which will increase the vaccination speed. That's Bramoro for you. Malefetsane says, morning team, it's highly impossible, Des, for our country to do that based on how slowly they're operating and the returns of the vaccines. We have 2 months now, yet only less than 1.5 million got it. Umberto Lewis saying that would really be great, but why don't we as Africa create a program with the same intention, then wait for the other countries to volunteer? Goodness gracious. At least we would be assured if we produced for all of Africa. Only if we were rich of unity, we would. Yeah. Thank you so much for interacting with us on this question, and continue to send your interactions at the agenda _SABC. And just to remind our viewers that you're welcome to call us on 084-8133-465. Let's take you back to that briefing by the Higher Education and Training with a report back on the effects of COVID-19 on education.
And I'm glad now the systems are working. Basically, really, we were trying to look at what was happening amongst young people between the age of 18 to 35 in South Africa. And we actually did 2 parallel surveys, which was one looking at the PSET sector, and also we also tried to find out some of the young people who were not in the PSET sector. But today we're really looking at the data we found from the survey that was targeting people who were in the higher education sector. And this study was approved by the HSRC Ethics Committee. And we did data collection online because, as you all know, at that time when we did the study, basically it was hard lockdown. And the only way you could do any research was actually using an online platform. So we used the Bino data-free platform to do most of our surveys, including this one. And if you look carefully, this kind of graph shows you when we did the survey. It's actually, it started in June around this time, which was the Youth Month. And again, we were trying to align it with the Youth Month celebrations and activities. And we ran the survey until beginning of September. And if you look at that graph there, it's showing you the curve of COVID cases in South Africa during the period when we did the study. And you can see those lines actually showing you the beginning and the end of the survey, but it also shows you how it was linked and actually aligned to the progression of the pandemic in the country. And of course, that was the first wave. We know that subsequently we then had the second wave and now the third wave. And these are some of the issues that we really explored in the survey, which was really issue of socioeconomic conditions, risk perceptions. You know, some of those have been mentioned by the CEO of Higher Health, well-being, mental health and social support, exposure to violence, and the impact of COVID-19 on learning and institutional support, which was really one of the key things we were trying to find out, especially with the lockdown and the closure of all institutions, such as universities and schools. And we analyzed this data utilizing data version 15.0, and to try and make sure that this data is representative of the young people in the institutions. This data was weighted using Stats SA's estimates of the young population aged 18 to 35 who are attending educational institutions. And this process, actually, we could only be able to do it through getting assistance from our colleagues at Stats SA, because this is data that's not normally benchmarked routinely. So we had to do it specifically. And that was one of the really key issues that took us time to actually make sure we want to get it right by getting Stats SA to assist us with this process. And then if we just to get to the results, if this is basically briefly showing the demographics of the respondents in the survey. A total of 13,119 young people responded to the surveys. And if you look at in terms of age, the majority were between 18 and 24 years of age, which is basically expected since these are young people in colleges and universities. In terms of gender, it was almost an equal split, with about 50.8% of those responding being female respondents and 49% being male. And so this was an equal split. And if you then look at the data in terms of where the respondents were, because this was actually one of the things we were trying to ensure that we get representativity across provinces. So the majority of our respondents, as you can see, they come from Gauteng, and then KwaZulu-Natal was second in terms of getting respondents. But we were really happy to see that even though this was an online study, we got people responding basically from across all provinces, even though the Northern Cape was the lowest, but still we were able to get some people responding even there. And in terms of where the respondents came from, almost a third came from rural communities, which was also quite good to have views from people in rural areas. And about a third also lived in townships, and a third also almost came from urban localities. And we are actually trying to ensure that we get people to respond from all different circumstances, and by constantly reviewing our data and ensuring that we then, kind of get the responses using different means to encourage people to take part in the survey. And we're also interested in finding out who were those who were responding. You can see a large, almost 50% of the respondents were actually first-year students. So as the years progressed, the response rate decreased. And we actually, as a team, realized that it was quite important for first years to kind of sort of feature in larger numbers, because they were the group that was affected most, because they had barely spent 2 months at university when the lockdown started, and they actually had to leave the campuses. So you can see that they actually participated in the study, and as part of actually still trying to link and understand what was happening because of the disruptions, because of the pandemic. And in terms of institutions, the large majority, almost just over 60%, it was university students. And then University of Technologies was 15.7%, and TVET colleges 14%. And I must say, in the beginning, we had struggles in getting participation from TVET colleges in such a way that we actually had to change how we were implementing the survey when it comes to TVET colleges, and actually had to do a hybrid model where we now had to actually, when people were allowed to come back to campus, try to approach people on site in campuses. And that's how we were able to move the response rate there towards the end of the survey. But in the beginning, we really saw that the numbers were really, really low when it comes to TVET colleges. And then we basically then looked roughly in terms of who was doing what type of qualification in terms of diploma, and the majority were undergraduate students, which is 44.2%. And then those who saying they were doing diplomas, they were about 22%. And then master's, PhD, very, very low response rate there. But it was understandable that undergraduates were actually probably most affected, and they also participated more than other levels of study. And then the survey that looked in terms of socioeconomic conditions during lockdown, and this focused on living situations, space to study, food security, and access to healthcare, which was the key factors that we were interested in, because the disruption of classes really this was a key issues around continued learning. So participants were asked what happened to them when the hard lockdown was implemented, and about 40% reported that they went back home and had to leave their campuses or even the towns where they were studying. And about 37% said they stayed at home like they normally do, which means these are people who don't stay in res. So they didn't have to actually move back to where they come from. And some 8% stayed with relatives, and about 5% said they had to rent a place to stay, and less than 1% said they had no place to stay. And of course, the survey was really trying to find out what happened to them when the lockdown was implemented nationally. And then we looked at the issues of the space for studying. About half of them, 49%, reported that they had a suitable place to study during the lockdown. And 20% said they had a suitable place some of the time. And almost a third, 29.3%, reporting that they had no suitable place to study during lockdown. So about a third of the people really, remote learning was not ideal for them at all, in whatever way. And then we looked at the issue of electricity supply, which was quite encouraging that 78.6% of the students had regular access to electricity, and only 5.7% did not have access to electricity at all during the lockdown. And about half the respondents reported having a mother with a paying job, and about 35% saying their father had a paying job during the lockdown. So we then looked at it in terms of food security, where we're asking people if they, how they were actually coping in terms of were they having access to food. And then about 2/5 indicated that they were not able to purchase their own food, which is actually quite worrying. And even though a majority said they actually had access to food through their families. And then about 28% saying they were able to buy their own food sometimes. So this was really an issue where food security, and it shows a similar pattern to the data, the study we did in the general population, that food security was an issue during the lockdown. And but even in households, regardless of whether these were students or just normal families. And then we looked at, in the past 30 days, sort of their food situation, and about 10% saying they were getting food donations and food parcels. And this was really asking those who had fought food insecurity. As you can see, the sample size now changes to about 2,600. So from the 13,000. So these were the people who had indicated that the challenges in terms of accessing food during the lockdown. So when you ask them further in terms of how serious the situation was, and then you look at on financial donations, about 10% relied on financial donations, and others 10% again on food parcels. And about 14.8% reporting that they do not always have food and go hungry on some days. And then if you look further, some say they relied on food given to them by people they know, which is relatives or friends. And again, you saw that among this group, the issue of food insecurity during lockdown, and it was quite a serious problem. And then we asked issues of whether they had less preferred foods, and if you are food insecure, you actually had to eat things, less preferred foods, like 36.1%, and about 23% saying they ate less preferred food sometimes. And then there's a worrying proportion of 12.6% who spent the whole day without eating sometimes. And another 16% saying sometimes they spent the whole day without having anything to eat. So food security really came out as one of the issues that needed attention. And as we go forward and the lockdown in its various stages, food security amongst young people is a critical area. And then we looked on the issues of COVID-19 on education and learning during the lockdown. And we asked people what was their main challenges, and the biggest challenge was the loss of study time, and followed secondly by not enough money for essentials in terms of personal items, and 42% saying loss of social contact with family and friends was one of their challenges, and 40% being not enough money for food as the fourth challenge amongst the young people. And then you also have almost 20% saying they were unable to pay their rent during the lockdown and the closure of institutions. And then we looked at the issue of access to the internet, because this was really the key thing that everybody needed to work remotely. You had to have access to the internet. And 42.7% reported that their institutions were providing them with data bundles. So which means more than half were not getting any data bundles from their institutions. And I'm sure those were some of the things that may have changed over time. And almost a third saying that they were buying prepaid data using their own money. And only 14% had ADSL or fiber at home to be able to learn remotely. And 5% saying they're using their cell phones to connect into the internet and be able to learn. And interestingly, if you look at the issue of those who had no access, 3.5% said they had no access to the internet at all, but 50% of those were from it's more pronounced amongst the learners who are in TVET colleges when you compare them to universities and private colleges. And you can see from this graph here that 90% of students who are in private colleges were actually, being able to learn remotely, as well as 80% of those in universities. And it gets worse, and with TVETs, only 38% reported they were actually able to kind of be able to still learn while their institutions was closed. And again, very clearly, in terms of who can learn remotely and who can't, this data shows us clearly the differences and in terms of the disparities between different institutions and locations. And then we looked at what support, say, they were getting from institutions during the lockdown. Again, you can see there's slight differences in terms of which institution you attend. Some institutions provided transport or money to return home, like you can see more in the universities, 32%. But one of the key things that they show that increased online learning support, again, universities and private colleges perform much better in those categories. In terms of provision of laptops and tablets, that was low, but still higher at universities and private colleges, about 25% at universities and 20% in private colleges. And then looking at the provision of free data bundle, as I've mentioned earlier, University of Technologies and universities actually did well. Over 85% were providing data bundles. And as I said, this data was actually shifting, I think, as the pandemic progressed, institutions were getting more and more prepared to provide some of these things. And you can see even the issue of free data access improved over time. But again, you can see clearly that the TVET colleges in all this kind of resources that you need to learn remotely, they were the worst performing category across the higher education institutions. And then basically we looked at whether it was easy or difficult to communicate with your institution during the lockdown. Again, you can see private colleges and universities, it was much easier for learners there to communicate with institutions. And again, with TVETs, almost 66% saying it was difficult for them to communicate with their institutions during the lockdown, and only 33% saying it was easy. And then additionally, we then looked at students' mental health and emotional support as one of the themes. As we know, that's really a critical area for most of us during the pandemic, to look after our mental health and emotional support. And basically you asked them what was their main source of social and emotional support. And most of them reported that families, 69.8% provided emotional support during lockdown. And then friends were second at 57%, and then as well as parents at about 43%. And online community, such as social media, about 28% reported that. And only 14.3% reported that no one was providing any emotional support to them. And then we measured what we call psychological distress using the Kessler-10 scale, where we use 10 items to measure distress. And over 65% of students experience mild to severe psychological distress, which is quite high and a bit worrying, because normally you don't want any psychological distress to function properly. And the higher proportion, which is between the 18 to 19-year-olds, reported.
We're coming out of that briefing. Professor Sibusiso Sifunda, he's the Chief Research.
When compared to the older groups, such as 25 to 29-year-olds, which was 28.7% and 29% for 30 to 35-year-olds. And this actually kind of makes sense, because the larger proportion was actually between the 18 to 19-year-olds in terms of our respondents, but also the 18 to 19-year-olds, pretty much all of them were in first year of university and college. And so to be all of a sudden be removed from the institution while you're still trying to almost get used to being at university. That's why I think a lot of them found it more distressful to deal with the lockdown compared to people who were older and that had been at university for more time before the pandemic. And then we looked at the issue of substance use during the lockdown, in a way, as a way of coping or dealing with the situation. And it was really encouraging to see that almost 78% said they were not using any substance at all, and only 17% reported using alcohol, and 6.1% reported that they use cigarettes. And so that this finding was actually quite encouraging and positive in a way, that people were not using negative ways to cope with the pandemic. So in terms of our key recommendations, it's basically that came out of the survey. It was really issue around institutional support, communication, health, and well-being being the key things that need to be addressed. And also, one of the things that we thought we could look on, especially a year later after it all began is actually to look at moving forward, how to deal with it in terms of staff support and on campuses, especially since now students are back on campuses, and basically just how to use the results from this to actually involve management as well as all the staff on campuses to be able to deal with this. And also the use of peer education models, as well as, as well as the issue of vaccinations, which is where we are moving now, and encouraging students to be able, once they're able to access vaccines, to actually be able to get vaccinated and be able to live with the virus, is basically where we are right now. And basically, just to quickly run through this, the issue of communication, as I've said, it's important, but I think it's now something that has been improved on. Institutions have been able over time to improve on this and be able to communicate more and better with some of their students during the pandemic. And data, as I said, data came out very strongly, and internet connection came strongly. But again, systems can be improved, but I'm sure there are systems that are already in place that basically are now able to make it easier to learn remotely, because the hybrid learning model is almost here to stay with us for a very long time. And in terms of having proactive health and well-being programs and on campuses being key, and also having multidisciplinary support mechanisms, which is what Higher Health, together with the campuses, are able to provide some of these services as recommended here. And to end it all, I'd just like to thank our collaborating partners who are part of this survey, and the funders as well, Science and Innovation, Higher Health as a collaborating partner, Higher Education and Training, as well as the UNFPA, who came on board to provide some of the funds that we used to conduct this survey. And I thank you.
Thank you so much, Professor Sifunda. I think it was a very rich and informative discussion, and it is clear that there's a lot of follow-up research that still has to be done and interventions being made, especially dealing with still the inequalities of our past and issues of food security. I hope that this report will be available online. I'm sure universities would like to really discuss these findings. So it's now my privilege to call upon our two CPUT colleagues, Professor Malette Moore, who's our Institutional COVID-19 Compliance Officer, and Professor Tandi Macha, the Dean of Health and Wellness Sciences, and they will briefly inform you about how CPUT has dealt with the virus and their response to it. Over to the two colleagues. Thank you.
Honourable Minister, Professor Aluwalia, Vice Chancellor, members of Executive Management, it's certainly a privilege to be talking to you today. It's now about 15 months into the pandemic, and we probably had quite a bumpy ride with COVID nationally, but to some extent, we managed to stem the tide in CPUT, and I think the story we are about to tell you, Minister, is really how that happened.
So maybe just to confirm our current position, in total over the full 15-month period, we've had 323 cases. Now, Minister, those cases were, with the exception of one, community acquired and not on campus. We've managed to retain a COVID-free campus almost at all times. We currently have a recovery rate of 98.4 at the advent of the third wave. Our current active cases are about 5. On average, we tend to have between 0 and 4 cases per week. And like I said, those are community acquired. We've had one possible mini cluster, 4 people, which was actually one index person plus 3, which was still investigating to actually determine whether it was community acquired. So, Minister, the question is probably how did we manage that? So our story began in March 2020. And we had some crucial challenges as an institution at that stage. You will remember it was a season of student unrest in South Africa, and CPUT was certainly also in the middle of that battle. The second challenge that we've always had was the high number of resident students that we have on campus. And because they are all from disadvantaged communities, many of them don't have any other home. And saying that meant that when most universities, when the president announced the national lockdown level 5 on the 23rd of March, were able to empty their residences, we were not. And we had about 1,853 students remaining. So under those conditions, what happened? And I think a lot of what's happened may not have been necessarily because it was the result of a vision or a plan, but it just happened in a way that we were able to combat the virus. And let me talk you through it. I think the first good thing that happened was that our executive management acted early and called together a day in which we had a proper planning in Durban. And what we basically did on that day was we got everybody who's relating to the management of health on campus into one room. And we formed a task team, which at that time was called the health cluster. Now that health cluster has actually become the structure that has become key in our COVID response, because that so-called task team is still meeting every second day since March 2020. We know everything that's going on campus, and we manage them accordingly. And I think that's kind of been the essence of our response, is really to have early information, to detect what's going on, and to be able to manage very swiftly when there's a crisis. So I think the structure has certainly become a key to our success. And we then added 2 further elements to the structure. We realized, well, as much as the health cluster is a good operational structure, we need to make sure that executive management and the health cluster interacts in terms of how decisions get made, etc. So we added the so-called command center, which meets every Friday afternoon, and it reviews all activities that happened on campus, all COVID responses that happened on campus, and it plans for the next week. And then we also realized we need to have some foresight. So we also added a so-called strategic think tank to the structure, which is really to look into the future, new trends, and how to manage them. So I think what's become very important in our response is really the fact that there's a few elements to it. Firstly, the DVC Teaching and Learning has taken charge of matters like the various modalities and the return to campus planning. And we as a COVID team have taken our cues from that. So we sit in those sessions where they've developed what they call the so-called carousel model, which talks about 4 modalities that are being used. We also have the opportunity to sign off on that return to campus plan as it's presented. And then everything else that we do is related to that. So typically, we've developed a kind of a common language in terms of the way we communicate in our meetings, in our documentation, etc. So we would look at what we call academic readiness, which explains the return to campus plan for the various modalities. Then the next part is obviously, how do we manage this return planning for students, and how do we manage students currently in res? Then, of course, staff matters. Then our facilities resolve sorted out? Do we have social distancing markings, etc.? And then my own structure, the support systems. Are all the health support systems in place? And I think it's become something that has become common language in CPUT. It's been presented to our council and to our MANCOM, and they understand what we're busy with. And the support has been united in this institution. I think it's probably been such a privilege to lead the support in terms of our own staff and students coming together against this common enemy. So maybe a few comments, Minister, on what do we believe are the best practices that we've observed in this journey. I think firstly, the first three S's of the McKinsey 7S, the strategy, the structure, and the systems. But very specifically, the fact that we managed to create a structure that fit well within our organizational culture, that people understand, they subscribe to 15 months into the pandemic, they're all still active in that structure. I think we've had a lot of success with our communication campaigns, as you might have seen on the outside of the building. We try to use all members of the community as our agents. Whilst we've never had a written agreement, I think the whole concept of the social compact has come into being. We regularly talk to student leadership, to unions, etc. I think the next part is obviously the whole issue of protocols that we try to package the moment we start observing best practices, to package it as a protocol. I've also discovered if I can protect the perimeter of this campus or any of the campuses, what happens inside is of a lower priority. So we placed a lot of emphasis on the screening outside and protecting the perimeter of our campuses. Also the fact that there will be imperfections, there will be mistakes made, accept them, but make sure that when that imperfection is detected, that you respond as swiftly as possible. Of course, also the rule, prevention is better than a response, but if response is required, do it properly. Keep a tab on how you spend time and make sure that it's well managed and well executed to the minutest level of detail. One directional flow in terms of the physical setup, to make sure we retain this prioritized mindset. Where is the action? Where is the virus going to come? And make sure that we prioritize it according to that. Also, our team certainly tend to endeavor to make sure our own lifestyles are in line with what we expect from people on campus. Remain one step ahead. We certainly encourage our group to read a lot and to make sure we stay abreast of what's happening nationally and internationally. What is the virus up to, and what is the world up to in its response, and how can we benefit from that? And then lastly, to make sure we maintain the discipline and that we manage any non-compliance that we've observed in that process. So around about January, Minister, our team realized that a next logical step in the management of the virus would certainly be if we would be able to take control of our own vaccinations for the whole CPUT community. And we were fortunate that in our team, part of our team is our facilities management group, who immediately identified a out-of-use old cafeteria that we managed to convert at basically just the labor cost of our own staff. And we reinstalled a air conditioning system there. We set up the stations. It's basically running cost-free because it's staffed by volunteers. It's really just the allowance of one person who's full-time there that it's costing us at this stage. So there's a whole story behind what we did to get it in place. But at that stage, our Dean of Health and Wellness Sciences was also being absorbed into the Western Cape health structures and started talking the same language. And then our minds met, and then we came together and we started doing it together. So at this stage, I'm handing over to my colleague, the Dean of Health and Wellness, Prof. Macha, to tell you the next half of the story. Thank you very much, Minister.
Honorable Minister, Vice Chancellor, Executive Management, as well as the media and other colleagues, good morning.
I just want to tell you a little bit about our faculty first, just to give you an overview. I'm not sure if this slide went, yes. Here I'm going to brag a little bit. The Faculty of Health and Wellness Sciences at CPUT has programs that are only offered at CPUT and allow those students to register with the Health Professions Council to be able to practice. We have other universities in the Western Cape that offer similar programs, but those students end up after 4 years having to come to CPUT, to our faculty, to complete those courses in order to practice. So those programs that are exclusively at CPUT, I've put it here very easily. Pathology, we train the medical laboratory scientists that do your COVID testing, amongst others. We have the emergency medical services, we have dental technology, and we have radiography, as well as the ophthalmics technicians. Nursing is common between us and UWC and Stellenbosch University. So I became the Dean of the faculty in January this year. And one of the things that I thought, we are in this unique position, we have this. So we started by saying, at the time, the country was battling with the testing. So we thought, if we are training the medical laboratory scientists that are doing the testing, and we've got the staff that are training them, we then approached the NHLS and asked them if they would want us to help them with the testing. Unfortunately, at that time, they didn't have their system. The other thing that the faculty also has, it hosts a SACHI chair from the NRF and Nedbank. It also hosts an MRC extramural unit. And last year, it collaborated with Stellenbosch University, University of Limpopo, Nairobi, and the University College of London, and started a project on COVID-19. And basically what that project was looking at was to see if, for example, we can use traditional biomarkers or even find some new biomarkers that can tell us what will happen when a person has been admitted to ICU, so we can sort of maybe work out what would be the prognosis. So like I said, we then started by saying, okay, we can help with testing. NHLS was not ready at the time to be able to set up their testing because we had the instruments, your PCR instruments that do the testing. And then following that, then the vaccines came, and then the faculty then became very much involved with the vaccination of healthcare workers, because our students actually work in the clinical practice and they needed to be protected. And so we played a major role there. And to date, I can say that over 60% of the students and staff of the faculty have been vaccinated already. And now, as we have been allowed, we are also vaccinating non-clinical staff, and we are on phase 1B and 2B. So that is just the size of the faculty and the number of students and the number of staff in that faculty. So how did CPUT become prepared? So the first thing that we did, the VC has mentioned about our strategy of the university, the oneness, and we just did not say we're going to work as a faculty. It truly has been a team effort, as my colleague has also mentioned. So we had 20 people, we started with 20 people, nurses in our faculty and staff from EMS, and we trained them to be vaccinators. And today, we then opened the vaccination center that these staff members are now managing 200 to 500. They can easily manage that. Our center that we opened, our selling point was that we want to first concentrate on the staff of CPUT and the students. And the reason, because of our living conditions, we live on campus, the students live here. There's a very higher chance of transmission if you've got students in the residence. But then we also did not want to be Ivory Coast. We said we would want to help the community around us, but our priority will always be first our students and staff. And then Stellenbosch University, today we are starting with them. They've asked us to help them because they don't have a center yet. So we're also vaccinating their university staff and students. And then our health science faculty, as well as looking at people that worked at CPUT, pensioners that worked at CPUT, we are also interested in vaccinating them, as well as also vaccinating the relatives of staff and these pensioners at our CPUT center. So what facilities do we have other than the vaccination center? We do have -80 degrees freezers that are backed by a generator. This becomes very important with the vaccine that we have now, the Pfizer vaccine, that requires very low temperatures if we have to store those. And those freezers have a capacity to store about 23,000 vials at a time, and that will translate to about 90,000 shots. In terms of the minus 20 degrees, that storage is limitless. And then we make use of our faculty expertise as well. So what have we achieved since we opened last week? We started very slow. We have vaccinated 316 people, of which 233 were healthcare workers and 83 were people over the age of 60 years. And the most important thing for us was that we started and we have not lost one vaccine. As you would know, with your Pfizer vaccine, once you've diluted it and you have mixed it, you cannot store it again. So what we do, we make sure that we use that vaccine, even if that person at that point in time, at the end of the day, is not a health worker. It's a life being saved. So this is the major team that we have. Melanie has been wiping, but these are the people that really played a major role in helping us. Professor Yosta from nursing, some people from my own faculty, the campus health, the HIV unit, health and safety. So it really has been a teamwork. It hasn't been a one-person journey. And I really want to thank all the people that were involved. Thank you very much.
Thank you so much, colleagues. I think really it's an exciting story. We have come a long way, and Minister, I can tell you, watch this space. We will also fill many other spaces in the country, and they will be in the news for all the good reasons that you will hear of. It's now my privilege and honor to call upon the Minister to address us. Minister.
Can I close this? Or it's gonna interfere? If I just close
You
it?
can close it.
Oh, I can, all right. Thank you very much. Good morning, everyone. Let me start by greeting Professor Chris Nhlapo, the Vice Chancellor of this University of Technology of ours here in the Western Cape, and the entire CPUT executive management. Let me also greet Professor Alwalia of the Higher Health and the whole Higher Health family that is here or have joined us virtually. Let me also greet Professor Crane Sudin, the Executive Director of the Human Sciences Research Council, Professor Sbusiso Sifunda, and thank you very much for a wonderful presentation and very informative on the study you did, as well as members of the HSRC study team. Since you were boasting, I may also as well boast that both the Department of Higher Education and Training, which is here today, is my department together with the Department of Science and Innovation, under which the HSRC falls. So no matter whether you like it or not, as CPUT, you can't run away from me. Let me also greet my staff in the ministry, our student and staff communities, members of the media, and esteemed guests. We are 2 days away from the 45th anniversary of the June 16 student uprisings, important struggles that actually began the journey towards the end of apartheid and its criminal regime. And therefore, it is very important that today we are doing what we are doing. I must say, I must admit, Professor Klapo, that I'm really bowled over by what CPUT is doing, which indeed confirms that this is one of our premier universities of technology. I'm also glad, and I must thank the media for being here to show what CPUT is, because sometimes CPUT is projected for its problems, you know, whether it's student protests or other troubles. But what gets buried beneath is that this is one of our premier universities of technology in this country, not just in the Western Cape. And I would even argue, for that matter, in the African continent. For example, without diverting, I have to mention this, that CPUT is going to be launching 3 satellites in Russia. 3 satellites in Russia. Now, someone was cheekily asking me in the media and saying, when I was talking about space science, why are you spending so much money on space science to go and study things that are up there when we don't have houses, when we may even be short of NSFAS? But I want to say that we have to understand the society, the importance of science. To study space means, for example, right now, because of space science, we know exactly how many informal settlements we have in South Africa and what facilities do they have and what facilities do they not have by going to space. What CPUT is going to be doing in launching these satellites is contributing to looking after the ships within the seas around South Africa, as well as protecting our harbors, which is protecting jobs and protecting our economy. So to invest in space is, in essence, allowing us to deal better with the problems that are facing us here on our dear planet, Mother Earth. So I think that it's important that we say that. Also, I must congratulate CPUT for having set up the first vaccination center in one of our post-school education and training institutions. I had offered to the Department of Health and my colleagues that if you are short of venues and places to do vaccination, all our universities and all our TVET colleges are there as spaces that can be used as vaccination centers. I'm very happy to say CPUT has led the way. And you need to give yourselves a big round of applause for that. Now, I also just need to say that, of course, it's very important that we are showcasing this during Youth Month, because what we may not have done adequately, and which today we are contributing to addressing that, is actually to focus on the impact of COVID-19 on youth. Because we have tended to say, because youth generally is resistant, even if they catch the virus, they don't have symptoms and so on, and then we tend to forget about them. But we forget to say how much youth gets affected by COVID-19. The fact that young people are losing their parents and grandparents due to COVID-19, it's trauma that our young people are going through. Today also, the way we bury people, although I must say on the one hand, I hope we keep some of the practices of not keeping people for long after they've passed away and of having small funerals. My gripe is that our funerals are too expensive. Maybe COVID-19 will help us then to actually have modest funerals. But even then, the fact that sometimes we can't even go to bury our families, ask yourself a question: what type of youth are we generating, and what kind of effects are we going to start seeing 20, 30 years from now, when these young people are grown-ups and adults running our country and running our institutions? So we couldn't have done better than focusing on the impact of COVID-19 on youth during Youth Month. The other issue also, of course, that you are highlighting here and has been highlighted by Professor Sifunda, is the impact of COVID-19 on teaching and learning. It's young people. And in particular, I am concerned about the impact of COVID-19 on first-year students, because they are the ones who need to be on campus most. They are the ones who need to adjust from school to university. So it's very important that we are focusing on this, as well as the important message of young people as carriers of the virus. As Professor Aluwalea was saying, human beings are the carriers of the virus. You can't say because young people do not get affected health-wise, therefore we should not focus on them, because they are often the ones who carry the virus into households and where they affect the elderly, their own relatives, some of which unfortunately, some of whom unfortunately they end up losing. So I want to say then, as we commemorate Youth Day in 2 days' time this year, we are grappling with this pandemic of COVID-19. But what I want to say in brief, because of time, not because this is not important, I would really like to thank Higher Health, Professor Aluwalea, and your team, and the work that we've actually been doing to assist our entire post-school education and training sector to deal with COVID-19. And we have been having a tireless effort together with your volunteers in assisting us in dealing with COVID-19. And of course, I must congratulate CPUT, how we have been managing it. You know, low rates of infection and high rates of recovery. That is actually very important. To this end, also, I would say Higher Health did this by capacitating and built through numerous online and in-person training sessions across all our campuses, and established a network of over 49,000 capacitated individuals. And that includes frontline staff, student support staff, including residents, wardens, and other support staff, training management across all our campuses. And among these capacitated or trained individuals are over 12,000 student volunteers that have been working with Higher Health on the COVID response. You know, the other important thing about this, and thanks media for being here, because sometimes my dissatisfaction is that you tend to show the negative side of our sector than the positive side. So students are not only out in the streets. 12,000 student volunteers have been trained to actually handle COVID-19 and its negative impacts in our own institutions. And that is very important. And thanks to Higher Health for that. I won't go into the COVID cases. We've had a number of institutions where we've had cluster outbreaks, but we've been managing them so far. And thanks to the work of Higher Health. For instance, since mid-October 2020, a few COVID-19 cluster outbreaks have been experienced in several institutions in the Eastern Cape, KwaZulu-Natal, here in the Western Cape, Northwest, and Gauteng. And to address these outbreaks, Higher Health, along with our leadership from institutions, have assembled multidisciplinary investigation teams, which have included people from the World Health Organization, our Department of Health, the National Institute of Communicable Diseases, as well as other relevant institutions like the National Health Laboratory Service, to manage and contain these outbreaks through early identification of infected students and staff, identifying their contacts and appropriately assisting them by early isolation and quarantine, thereby managing to break the chain of COVID-19. I'm therefore very appreciative that Higher Health and HSRC, through the support from DHET, from the Department of Science and Innovation and the United Nations, have undertaken a study on the social impact of COVID-19 among post-school education and training sector youth in South Africa. Before I say something about this, I must also just say a challenge, Professor Aluwalia, to Higher Health. You have accumulated a lot of experience on student wellness. And the model of Higher Health, its advantage is that it seeks to deal with student and staff wellness comprehensively. So we are not only dealing with HIV and AIDS, TB, other diseases, we are also at the same time dealing with an important matter, which is mental health, which has been highlighted here. In fact, the tendency for us has been to count the dead, significant as that is, but pay less attention to the mental health implications of COVID-19, to those who have lost families, who have lost friends, who have lost colleagues in the workplace. I'm glad CPUT is attending to this, but also Higher Health, do us a favor. Your model actually should be the model of the rest of our health system. It shouldn't just be for higher education. Therefore, I think it may be important that you write about this, but also make videos and hold webinars on your model of comprehensive student wellness and its implications for handling pandemics. Science tells us that we have entered the age of pandemics. COVID-19 is not going to be the last pandemic. That's why, amongst other things, as government, we are now investing in building our local production and local development of vaccines, for instance, as the president was highlighting being at G7. And as the Department of Science and Innovation, I have been given the task to lead the effort in the local production of vaccines. But I'm very confident that I will achieve this task if there is CPUT and our other institutions around working together with us. Now, on these results that have just been announced, which I'm officially launching today, and they will be in the media publicly, Higher Health, again, partnered with the HSRC to provide and to undertake and to do the study. The survey, as it has been said, explored young people's experiences and perspectives on the social impact of COVID-19 on education and learning in South Africa. Which, of course, this included gathering of knowledge, attitude, and perceptions, as has been explained, of young people. From the results, we know that 53%, for instance, of the respondents thought they were at low risk of contracting COVID-19, and 15% perceived themselves as high risk. This is important information because it means we need to intensify education. We need to intensify campaigning. But I would like to say it's not a bad picture at all that is emerging, that we've managed as a sector to deal relatively well with the pandemic and also to manage the completion of the 2020 academic year, albeit most of it in 2021, but that is a very important achievement despite the unevenness, because COVID-19 has exposed the depth of social inequalities in our society. But the picture is not that bad at all. And if the study tells us that more than 75% of our students do not engage in alcohol, drinking, and smoking as a way of coping, that's a very strong foundation in building a sober nation. In building a sober nation, I need to underline that, and also to do away with smoking. Both things, by the way, which myself I have abandoned. Just as way of example. I'm now a true teetotaler, except that I don't drink tea. But I do drink my water, VC. Now, this gives us very important. Now, I want to urge all our institutions to study this report very closely. And also, I want to urge all the stakeholders, whether it be students or trade unions, in our sector and other staff, management, to study this report done by the HSRC working with Higher Health, so as to look at what is it telling us and what more do we need to do. Already on the 27th of January this year, I urged our institutions and Higher Health to mobilize and capacitate our own healthcare workers, staff and final year health science students to volunteer to be trained and act as extra hands supporting the Department of Health, as it is impossible for the Department of Health on its own to vaccinate 40 million people. So it needs our support. I'm very proud of CPUT. It's very rare that you hear Stellenbosch University being assisted by a university of technology in handling its own challenges. That is very good. It means CPUT is doing things that are very important and appreciated by our other premier higher education institutions. That is something that is very important. I don't know why you don't clap for yourself. Today, we are seeing the real CPUT, not the CPUT that often gets projected in public, you know, as if it's a broken institution. It's not a broken institution. It is an institution that is very much alive. I also commend our institutions, all of them, and of course working with Higher Health, for the mobilization of healthcare workers, staff, and final year health science students who have volunteered and trained to act as extra hands. It's very interesting that your faculty or school, whatever you call it, of health, its staff, its students, have been part of the effort. In other words, you haven't locked yourself into your laboratories and into your lecture rooms, but we have said, we have got skills. We will start here at CPUT. But what is also good is that you are doing something I'm always emphasizing, that as it has been said by the Vice Chancellor, if I'm not mistaken, or somebody else here, that universities must not be ivory towers. They are part of communities. In fact, ideally, universities must be what we call anchor institutions in the communities and in the regions in which they are located. The fact that we are vaccinating your retirees, as well as other 60+ people through your university, is something also that is very important. Let me conclude. There's lots I can say, by the way. And I am very, as I say, truly bowled over. And I've got many takeaways, PATCOs, to take out of today's engagement and exposure. But let me conclude by saying, I take this opportunity to thank, firstly, the Vice Chancellor and his senior management, Professor Nhlapo, for the good work that we are actually doing in this institution. And let me also thank all the CPUT staff, and indeed all our other post-school education and training institutions, for collaborating and working together with us. If we didn't work together, we could have lost the 2020 academic year for many of our institutions. I am convinced. We put in a lot of hard work as the department. I must thank my own staff. But working on our own, without your cooperation, we would not have been able to do what. Also, by the way, one good example here is that we have a team, a task team, that has been managing COVID-19, which is very important. Let me also thank Professor Alwalia, Professor Sudin, and Professor Sbusiso Sifunda, the latter two being in the HSRC, for undertaking this study that I have been launching today. Please continue to do more research, because research is most important. One positive thing out of the dark cloud, as the English saying goes, every cloud has a silver lining. The one silver lining out of all this is that people are beginning to understand science and the role of science. You know, when you hear people today talking and using some of the scientific terms, it means science, the role of science is becoming more and more known. And let's use this platform to educate our communities, our society about science, that to invest in space science, as I said in the beginning, is not just about space, but it's about improving our living environment where we are here in our Mother Earth. As I have said, thanks Higher Health for your model, which even deals with the impact of gender-based violence and femicide, which is another big pandemic that we have. We can't be a country if we are destroying our women. Simple. Me, I'm a proud mama's boy because I know what mothers can do. And by the way, without the mothers and without the women, a lot of what we are doing that is good in our country would not be happening. So to allow our women to be abused is to abuse ourselves as a country and as society. The fact that we are doing a lot of work, I'm pleased that on my side, I have released a framework for gender-based violence for all our institutions, and I'm hoping our institutions will translate this into their own institutional strategies, which are very important. But I mustn't forget the most important, our COVID-19 warriors that have been trained by Higher Health, our student volunteers. You are exemplary. By the way, you will never be the same, given the experience you are acquiring while you are studying about doing something concrete to make an impact and change the lives of your own colleagues and protect them from this virus. That is very important. Let's give our student volunteers, our warriors, a good round of applause. Let me end by saying, as you have been ably reminded, let's continue to keep on keeping safe, because our country needs you, and that we remain safe, we observe all the health protocols. But I must say, CPUT, we have set a very good example. I'm looking forward now to be visiting your vaccination center so that practically also the media is invited so that you can see for yourself that what we are saying here, how is it happening in actual practice. Thank you very much.
Thank you so much.
Before I ask our media spokesperson, Lauren Gansley, to come to the front to facilitate the media question and answer session, Minister, I would just like to say that CPUT already has responded to the Act about gender-based violence and the policy that's out there. And proudly, we can say that the entire executive team was trained in May, and we've already created our institutional high-level committee, which will be chaired by our Vice-Chancellor. So I think, according to my understanding and from colleagues from the DED, we were also the first to take that policy document serious and act upon it. So I think for that, we can also give ourselves a round of applause. Lauren, if you could take over for the media session.
Thank you, Melanie. Thank you, Professor Ruma. Thank you, Minister. As someone who studied at this campus and now has the privilege of working here as the institutional spokesperson, I'm just so grateful, and I speak for the 40,000 staff and students, for decisive leadership during the pandemic. I think it has been really comforting. And then just to say to the journalists in the room, we will have an opportunity. I know especially the TV and radio colleagues that we have here, you will want one-on-ones, and I've spoken to the minister's media team. So they're happy to accommodate you over at the media center, which I think will be for better visuals than right here anyways. So I think we can check in the room if anyone does have any specific questions. You can use the mics if you have one. Otherwise, if you prefer to ask your questions later, can we just check? Lindsay, Ati, Craig, you prefer later? It might be easier for time as well. I think, Prof, they prefer to ask the questions later. So thank you so much. I think we can wrap then.
So colleagues, with that, we are coming to the end of our proceedings here today. And once again, thank you for all our wonderful special guests for honoring us, for the media, for our executive, for students, for everyone. The minister and a little small team will visit the vaccination center. Unfortunately, not all of us can go there because also of confidentiality and ethics, but I will leave that in the hands of Professor Moore. Thank you so much and stay safe.
Thank you very much. Just to say to the